Okay, dear colleagues, I'm continuing my project of article analysis, and today I want to show you a very interesting article. This article was published in Journal of Aeronautics in 2022 by amazing, super successful group of Professor Jose Siqueira and Isabel Rocket from Brazil. And we will do some trick because many of the dentists have not enough time today. They just see the name of article and make the conclusion in rare cases abstract. And I want to show you that it's maybe tricky. For example, the name of this specific article, a name that enhancing intracanal antibacterial effects of sodium hypochlorite with hydronic acid or citric acid. We're thinking that maybe they have some infected teeth and they use pure NaCl with citric acid, NaCl with HDP, and they did some examination. Okay, what about conclusion? A conclusion that freshly combined NaCl HDP, hydronic acid, and the alternate use of NaCl and citric acid, alternate use. What is alternate use? Okay, we'll see. Followed by expand the finisher agitation. Wow, we have here some agitation, resulted in significantly higher intracanal bacterial reduction than NaCl alone. Okay, just NaCl, it's not good. NaCl with HDP or citric acid, it's good. This is, a very simple conclusion, but I like to go inside. First of all, to understand if this article really good or no, I go to materials and methods, and I want to see how they did it. They extracted 66 mandibular premolar teeth with single canal. Super important part of the story. When we have one root, one canal, it's simple anatomy. Okay, we will take it in the account in the end, because when we have two canal in one root, we can have isthmus, and disinfection process will be much more difficult. Okay, this without endo, of course, close up, it's good. They instrumented it up to number 20. It's okay to do the same initial diameter, it's good. And contaminated with Enterococcus faecalis for 30 days. Important point. Why? Because Enterococcus faecalis, it's a microorganism of secondary infection. We see these microorganisms, especially in treatments, but almost no in primary treatments. Important. Okay, after 30 days, they did microbiological examination as one stage to see the number of microorganisms. Okay, now important to have a free group, NaCl, HDP, NaCl, citric acid, and it's very important to do pairing of teeth. How I can compare? I could do some X-ray, okay, from buccolingual and from proximal, but the best way to do it's microcomputer tomography. What they do, wow, they do microcomputer tomography, and they did a pairing after. Very good. Now, super important part of the story, especially today, it's temperature. They did all in condition of the body in 37 degree, so important for activity of NaCl and so important for expand the finisher instrument that will give his final form just if the fluid will be in 37 degree. Super important part of the story. Okay, how they do mechanical preparation? They did it with a reciprocating instrument, Reciproc Blue 2508, with free groove with NaCl or NaCl HDP, or again, this world alternated citric acid and NaCl. I will explain next slide what is alternating. And in the end, they check again the number of microorganisms. And finally, they use expand the finisher by recommendation of manufacturer, 1 minute per canal, and they did a third microbiological examination. Important. Okay, now why it was important for me, for example, to see that they use reciprocating instrument, because what we know from literature, that reciprocating instrument have a problem with debris. They push much more debris over the apex. It's not the issue here, but what is a real issue here, they push much more debris laterally. Okay, and these debris that push laterally together with smear layer can spatially separate microorganism and our irrigation and reduce our antibacterial influence on this microorganism. It's also, by the way, may inhibit most of irrigation material. Important part of this research is reciprocating. And what about alternating use? To understand the idea of alternating use, we will go to the basic. Basically, in NaCl, we have two active forms, hypochlorous acid, HO-chloro, and hypochlorite, O-chloro-. And both of them have a different activity. Each of them have different activity. O-chlor is cleanser. It will dissolve organic tissue and extracellular matrix of biofilm. HO-chlor, hypochlorous acid, disinfectant. It will kill microorganisms. And what we have pH about 12 when we are buying regular NaCl in the world. In this pH 12, we have mostly hypochlorite, and we have amazing cleanser. An idea that was raised was to change this pH to low to pH and to have more hypochlorous acid to have a better disinfectant. From these ideas, the story of alternative use of NaCl and citric acid. Why not to mix it from the beginning? Because during this mixing, we will neutralize that NaCl. And the idea was just to put it alternately. But maybe in this situation, in part of the cases, we have a neutralization of NaCl, and we will see now in this research. What they did finally is the same stages. Okay, in the beginning, they flushed the canal with saline. And after they checked the microbiological examination, the quantity of microorganisms. After they, in the group of NaCl citric acid, they use NaCl, after they use reciproc, after they use citric acid, alternating, and they did glide pass. Why glide pass 15 in canal that were all the canal 20 from the beginning? Why? Again, because it's reciprocating instrument. A reciprocating instrument can create a huge amount of debris, and you must check it. It's okay. It's nice. And they continue, again reciproc, NaCl, again glide pass, again citric acid, again glide pass, NaCl, microbiological examination, and after NaCl, citric acid, and XP finisher. In the group of NaCl and NaCl HEDP, it was just one irrigation material because NaCl alone and HEDP was mixed before the use, okay? But the whole volume and time was the same. Very, very important. And now we will go to see the result. It's interesting, they do two parts of result. Okay, first of all, quantification, the number of microorganisms in all these three stages. And it's very interesting to see how it will be changed. The biggest change was from S1 to S2, from the canal that was full in microorganisms and to the end of preparation with irrigation. For example, NaCl alone, they start about 83,000 microorganisms in canal, and they go to just to 558 microorganisms in canal. Nice. Now they put NaCl inside and they take XP and the finisher, they start to work, and also no difference. It's one of the most interesting part of this research. Also no difference after XP and the finisher. The total reduction just about 6%, nothing. You can see it here, blue line. It's reduction with mechanical preparation, and now with XP, almost no reduction. What about alternating use of NaCl and HEDP? Okay, they start to work again, here about 31,000 of microorganisms, and they go to 158 microorganisms, excuse me, with HEDP. It's grouped with HEDP, it's going to 185 microorganisms, amazing reduction, whoop, red line. And now they use XP finisher and they go to just 5 microorganisms per canal. Wow, the great result. What about citric acid? Citric acid with NaCl, alternating regime, NaCl, citric acid, NaCl, citric acid, they go to about 595 microorganisms, by the way, a little bit more than just NaCl. And you see they're almost the same here, also the same point. But after XP, they go to 121 microorganisms. Lesser, much lesser with NaCl alone. You cannot see here. Okay, it's very interesting. The difference in group of NaCl citric acid and NaCl alone was just after XPF. Okay, but what they did additionally, I like this approach. They have the same research and two parameters. They did a check. They checked also the total number of negative culture. Again, when we have a negative culture of canal, it doesn't mean that we have sterilized the canal. We know that it's high quality disinfection in this specific case in main canal. We have no idea about dentinal tubules, lateral canal, and in complex anatomy and isthmuses. But of course, a high level of disinfection. Please see, it's super interesting here, the result within NaCl group. Within the NaCl group, after mechanical preparation, we have 53% of negative culture canal. After XPF, we have less, 47. Wow, how it can be? Why now I have less quantity of canal with negative culturing? I have my own idea. I don't know if I'm right or no, but I can think about it. Again, I go back to the story of smear layer, into the story of debris. Maybe beneath the debris and smear layer I have microorganisms that I can show it by microbiological examination of main canal. Now I will take an XP finisher and he will scrap a little bit this smear layer or maybe debris, and suddenly microorganisms go out. And now I have no so good results. This is how I can explain it. When I go to the group of alternating regime with NaCl and citric acid, the amazing thing that in first stage, the results less effective than purine of NaCl. Just 44% of the cases was negative culturing. Again, my explanation that during this alternating regimen, I just decrease the efficacy of NaCl because citric acid neutralize it. And just in the end, after agitation with XP the finisher, I have a better result, 72%, that's statistically significant, more than NaCl alone. Here I can explain it because during all this work, NaCl work on organic part and citric acid on inorganic part of smear layer and debris, and finally together with agitation it worked. And the last group of NaCl HEDP, the best result from the beginning. Already in the first stage, NaCl HEDP give us 75% canal with negative culturing. And after XP, it increased to 85. Now you do all this work and now you will understand why I changed my conclusion. Again, conclusion of O-Turbo that both freshly combined NaCl HEDP solution and alternate use of NaCl and citric acid followed by expanded finisher agitation resulted in significantly higher intracanal bacterial reduction than NaCl alone. Now I will try to explain myself. First of all, my conclusion that all this work give information about very specific condition. Simple anatomy, one root, one canal, secondary infection, and a reciprocating instrument. And in this specific condition, what I have in this research, first, NaCl alone with and without expanded finisher agitation have limited ability to reduce intracanal secondary infection. 1. 2. Alternative use of NaCl and citric acid reduced antibacterial efficacy. But this antibacterial efficacy can be improved by expanded finisher agitation and the finish stage. And last conclusion, use of freshly combined NaCl HEDP solution significantly reduced intracanal secondary infection that can be improved by expanded finisher agitation. This is my view of this interesting and important article. And of course, all the time that I see an article like this, I think, what can we check in the future researches? My idea that can be done in the future researches is to check multi-species biofilm of primary infection, complex anatomy, one root, two or more canal with isthmuses, a regular regime of citric acid and NADTA, not this, very rare one, regular one. Most of work we do in NaNoCell. In the end, we use or citric acid or NADTA, and just after we will use agitation technique. It's very interesting to see how it will work. And of course, personally, I prefer full rotation instrument, and I want to see it in the research. I hope this article was interesting for you. I will continue this project. I think it's interesting. Please write me your comments and I will answer it. Have a nice time. Bye.